There is a 79-year-old woman lying in a hospital bed right now at this exact moment, somewhere in this country, because of something most people would never imagine could become a medical emergency. Stool stuck inside her rectum, so hard, so compacted, so completely immovable that her own body could not expel it. And what started as simple constipation became a 5-day hospital stay, manual extraction by a nursing team, and a recovery that took weeks. I have seen this happen more times than I can count in my career, and I am going to tell you something that may shock you. This is not rare. This is happening to seniors across this country right now, today, while they sit quietly, embarrassed, telling no one, assuming it will pass on its own. And in the next few minutes, I am going to show you exactly why this happens to the aging body, exactly how to recognize the warning signs before it becomes a hospital emergency, and one specific, simple kitchen cabinet remedy involving a single teaspoon of a common substance that has helped thousands of my patients get relief within minutes, not days. My name is Dr. William, and I have spent the last 23 years as a colorectal surgeon, which means I have spent my entire career looking directly, literally, at the part of the human body that almost nobody wants to talk about. I have seen what happens when this problem is ignored. I have also seen how simple, how genuinely simple the solution can be when you understand what is actually happening inside your body. Stay with me until the very end of this video, because what I am going to share is not just about relief, it is about preventing the kind of medical emergency that sends far too many seniors to the hospital every single year for something that was completely avoidable. Let me start by being completely honest with you about something that nobody wants to discuss at the dinner table, but that I discuss every single day in my practice. Fecal impaction, which is the medical term for stool that has become so hard and so compacted that it cannot be passed normally, is one of the most common reasons that older adults end up in emergency rooms for a gastrointestinal issue. And the reason it happens so frequently after the age of 60 comes down to several specific changes in the aging body that almost nobody explains clearly. As we age, the muscles of the colon, specifically the smooth muscle responsible for what is called peristalsis, the wave-like contractions that move stool through your digestive system, naturally lose some of their strength and coordination. At the same time, the nerve endings in the rectum that signal to your brain that it is time for a bowel movement become less sensitive, which means many seniors do not feel the urge to go as clearly or as urgently as they did when they were younger. Combine this with reduced physical activity, which is extremely common after retirement or after a joint replacement or after any period of reduced mobility, and you have a colon that is moving stool more slowly while a rectum that is sensing the need to evacuate less effectively. The water content of stool also becomes a critical factor. As stool sits in the colon longer because of slower transit time, the colon continues to absorb water from it, which is its normal function. But the longer stool sits, the more water gets absorbed, and the harder and more compacted that stool becomes. By the time it reaches the rectum, it can become so dense and so dry that the body's normal mechanisms for pushing it out simply cannot generate enough force. I want to tell you about a patient I will never forget, a man named Eugene, an 81-year-old retired postal worker from Sacramento, California. Eugene had been managing what he called occasional irregularity for years, simply assuming it was a normal part of getting older. He took a fiber supplement here and there. He drank more water when he remembered. But over the course of about 10 days before he came to my emergency department, Eugene had not had a single bowel movement. He told the triage nurse he felt bloated and uncomfortable, but was too embarrassed to come in sooner. By the time I examined him, Eugene had a fecal impaction so severe that it required manual disimpaction, a procedure I will not describe in graphic detail, but one that is exactly as uncomfortable and undignified as it sounds, followed by 3 days of hospitalization to manage the resulting complications, including a partial bowel obstruction. Eugene looked at me from his hospital bed and said something that has stayed with me throughout my entire career. He said, "I didn't know it could get this bad. I thought I was just being dramatic if I called the doctor over not being able to poop." Eugene was not dramatic. Eugene was experiencing a legitimate, serious, and entirely preventable medical condition that simply needed to be taken seriously much earlier. Let me explain to you the warning signs that your body gives you before a simple case of constipation becomes a full fecal impaction, because recognizing these signs early is the single most important thing I can teach you in this video. The first warning sign is going more than 3 days without a bowel movement, particularly if this is unusual for your normal pattern. I understand that bowel habits vary significantly from person to person, and some people naturally go every day while others go every 2 or 3 days as their normal baseline. What matters is not a universal number, but a change from your own normal pattern. If you typically go daily and you have gone 3 days without any movement, that is your body's first signal. The second warning sign is a feeling of incomplete evacuation, meaning you have a bowel movement, but you feel like there is still more stool present that did not come out. This sensation, when it persists over multiple days, often indicates that stool higher up in the colon is backing up behind a partial blockage lower down. The third warning sign is small, hard, pellet-like stools, sometimes described as looking like rabbit droppings, which indicates that stool is moving so slowly through the colon that excessive water absorption is occurring even in stool that is successfully passing. The fourth warning sign, and this is one that surprises many people, is paradoxical diarrhea or liquid leakage around a hard mass. This sounds contradictory, but here is what is actually happening. When stool becomes severely impacted and hardened in the rectum, liquid stool from higher in the colon can sometimes leak around the hardened mass and escape, which patients and even some caregivers mistake for diarrhea when in fact it is a sign of severe impaction requiring immediate attention. If an older adult who has been constipated for several days suddenly develops what looks like diarrhea, this is not necessarily improvement. It may be a sign that the situation has become more serious, not less. The fifth warning sign is abdominal bloating, distension, and discomfort that progressively worsens, sometimes accompanied by nausea, as the colon becomes increasingly distended by the backed up stool. If you or someone you are caring for is experiencing several of these signs together, particularly going more than 5 days without a true, complete bowel movement, this requires medical attention, not home remedies alone. Now, I want to walk you through exactly why this remedy that I'm about to share works, because I believe understanding the mechanism makes you far more likely to use it correctly and to recognize when it is the right tool for the situation and when it is not. The remedy involves 1 teaspoon of food-grade magnesium citrate powder, which is different from the magnesium citrate supplement tablets you may have seen at the pharmacy, mixed into a small glass of warm water and consumed on an empty stomach, ideally first thing in the morning. I want to explain the science behind why this specific approach works so effectively and so much faster than many of the remedies people try first. Magnesium citrate works through a mechanism called osmotic action. When magnesium citrate enters your digestive tract, it is poorly absorbed by the intestinal wall, which means it remains within the intestine and draws water into the bowel through a process called osmosis, where water moves from an area of lower particle concentration to an area of higher particle concentration. This influx of water does 2 critically important things simultaneously. First, it softens the hardened, compacted stool that has been sitting in your colon, breaking down the dense mass that your body has been unable to move on its own. Second, the increased water volume in the colon stretches the intestinal walls, which triggers stretch receptors that stimulate peristalsis, the very muscle contractions that move stool through and out of your body. This combination of softening the stool and simultaneously stimulating the muscular contractions needed to move it is precisely why magnesium citrate works so much faster and more completely than fiber supplements alone, which only add bulk without necessarily softening already hardened stool or stimulating the muscular response needed to move it. I want to be very specific about the dosing and the method because precision matters here. 1 level teaspoon, which is approximately 5 grams of food-grade magnesium citrate powder dissolved completely in 8 ounces of warm water. The warmth of the water matters because it helps the magnesium citrate dissolve more completely and because warm liquids in general have a mild stimulatory effect on intestinal motility. This should be consumed on an empty stomach, which means either first thing in the morning before eating anything or at least 2 hours after your last meal. Most of my patients report a bowel movement within 30 minutes to 2 hours of taking this preparation, though the exact timing varies based on individual factors including how severe the impaction is, your hydration status, and your individual digestive transit time. I want to give you an important safety framework around this remedy because while it is genuinely effective, it is not appropriate for every situation and it is not meant to replace medical evaluation when symptoms are severe. If you have gone more than 5 to 7 days without any bowel movement, if you are experiencing significant abdominal pain rather than mild discomfort, if you have vomiting, if you have blood in your stool, or if you have a known history of bowel obstruction, kidney disease, or heart conditions that affect electrolyte balance, this remedy should not be your first step. Magnesium citrate affects electrolyte balance in the body, and individuals with kidney impairment may not be able to clear excess magnesium efficiently, which can lead to magnesium toxicity in rare but serious cases. If you have kidney disease of any stage, please speak with your doctor before using magnesium citrate in any form. For the vast majority of seniors experiencing mild to moderate constipation that has not yet progressed to a severe impaction requiring medical intervention, this remedy represents a fast, accessible, and well-researched option that can provide relief and prevent the situation from escalating to the kind of emergency that Eugene experienced. Before I continue, I want to pause and ask you to subscribe to this channel if this information is helping you, because every single week I bring you research-backed information specifically for the health concerns that affect seniors, including the topics that are uncomfortable to discuss anywhere else. 1 click, 1 second, and you will have access to information like this every week going forward. Now let me share with you the deeper picture of why this problem is so common in seniors and what you can do beyond a single remedy to prevent it from happening in the first place. I want to introduce you to a woman named Beverly, a 74-year-old retired hairdresser from Tulsa, Oklahoma, whose story illustrates something important about the compound factors that lead to chronic constipation and eventual impaction in older adults. Beverly had undergone a hip replacement 8 months before I met her, and during her recovery period, she had been significantly less active than her normal baseline. She had also been prescribed an opioid pain medication for several weeks following her surgery, which is something I want every senior and every caregiver to understand clearly. Opioid medications, including commonly prescribed options like oxycodone and hydrocodone, have a well-documented and significant effect on bowel function. They directly slow intestinal motility by binding to opioid receptors located throughout the digestive tract, not just in the brain. This means that anyone taking opioid pain medication, even for a relatively short course following surgery, is at substantially elevated risk for severe constipation and impaction, a condition that has its own specific medical term, opioid-induced constipation. Beverly's surgeon had not specifically counseled her about this risk, and by the time her pain medication course ended, she had developed a pattern of severe constipation that persisted for months, even after she stopped taking the opioid, because the impaction itself had become a self-perpetuating cycle. The colon had become so distended from the buildup that its normal muscular function was further impaired. When Beverly came to my practice, we worked through a combination approach, addressing the immediate impaction, then rebuilding her colon's normal function through a structured combination of hydration, fiber, physical activity, and short-term use of osmotic laxatives under medical guidance. Beverly's case illustrates something critical. If you or someone you love is prescribed opioid pain medication for any reason, After surgery, for chronic pain, for any condition, a proactive bowel regimen should be started at the same time the pain medication begins, not after constipation has already developed. Ask your doctor specifically about this if you are prescribed opioids. I want to talk now about the broader lifestyle factors that contribute to chronic constipation risk in seniors, because the single teaspoon remedy I shared is genuinely effective for acute situations. But preventing the problem from recurring requires addressing the underlying contributors. The first and most significant factor is hydration. As we age, our sense of thirst becomes less reliable, meaning many seniors are mildly dehydrated without feeling thirsty at all. This is a critical issue because adequate water intake is essential for maintaining stool softness. Research published in the American Journal of Gastroenterology has found that adults over 65 who consumed less than 6 cups of fluid daily had significantly higher rates of chronic constipation compared to those who maintained adequate hydration. I want you to make a specific, measurable goal of consuming at least 8 cups, which is 64 ounces, of fluid daily. And I want you to track this rather than relying on thirst as your guide, because thirst becomes an unreliable signal as we age. The second factor is dietary fiber, and I want to be specific about the type of fiber that matters most for this particular issue. Soluble fiber found in foods like oats, psyllium husk, chia seeds, and certain fruits, including pears and apples, absorbs water and forms a gel-like substance that softens stool. Insoluble fiber, found in whole grains, vegetables, and the skins of fruits, adds bulk that stimulates the colon's muscular contractions. Most seniors benefit from a combination of both types, and the general recommendation for older adults is between 25 and 30 grams of total fiber daily, though I want to caution that fiber should be increased gradually over several weeks rather than all at once, because a sudden large increase in fiber intake without adequate corresponding water intake can actually worsen constipation temporarily by adding bulk to stool that does not have enough water to remain soft. The third factor, and one that is frequently overlooked, is physical activity. Even modest physical movement stimulates the muscular contractions of the colon through a mechanism related to overall increased blood flow and nervous system activation throughout the digestive tract. Seniors who are largely sedentary, whether due to mobility limitations, recovery from surgery, or simply a less active lifestyle after retirement, have measurably slower colonic transit time compared to those who maintain even modest daily movement. I am not asking you to begin an intense exercise program. I am asking you to walk for 15 to 20 minutes daily if you are physically able, because this simple, accessible activity has a measurable, research-supported effect on bowel regularity. The fourth factor is what I call the urge response, and this is something that I believe is under-discussed in conversations about senior bowel health. When you feel the urge to have a bowel movement, your body is sending you a time-sensitive signal. Many seniors, particularly those managing busy schedules, caregiving responsibilities, or simply the habit of a lifetime of prioritizing other tasks, delay responding to this urge. Over time, repeatedly ignoring the urge to defecate trains the rectum to become less sensitive to the sensation of stool presence, which directly contributes to the kind of impaction risk we have discussed throughout this video. I want you to make a specific commitment to yourself today. When you feel the urge, respond to it within a reasonable time frame rather than postponing it repeatedly. This single behavioral change, while it sounds simple, has genuine physiological importance for maintaining healthy rectal sensitivity as you age. I want to come back to Eugene for a moment, the postal worker from Sacramento whose case opened this conversation for me years ago in a way that genuinely shaped how I practice medicine. After his hospitalization and recovery, Eugene became, in his words, evangelical about bowel health, a phrase that always makes me smile when I think about it. He started tracking his water intake. He added a daily walk to his routine. He kept psyllium husk in his kitchen and used it consistently rather than reactively. And he told me something at his follow-up appointment that I have repeated to countless patients since. He said, "I spent 81 years too embarrassed to talk about this, and it almost put me in the hospital for a week. I am done being embarrassed." I share that with you because I suspect some of you watching this video have felt exactly that same embarrassment, that same reluctance to bring up bowel concerns with your doctor, your family, or even in your own mind as something worth taking seriously. I want to give you full permission, as someone who has spent 23 years as a colorectal surgeon looking directly at this part of human health every single day, to take this seriously without an ounce of shame. This is simply human physiology, and addressing it proactively is no different from managing your blood pressure or your cholesterol. It deserves the same attention and the same lack of embarrassment. I want to give you a clear, practical summary of everything we have covered today so that you can act on this information immediately. First, know the warning signs. More than 3 days without a normal bowel movement, a feeling of incomplete evacuation, small, hard pellet-like stools, paradoxical liquid leakage around a hard mass, and progressive abdominal bloating and discomfort. If you notice several of these signs together, take them seriously. Second, for mild to moderate constipation that has not progressed to a severe emergency, 1 level teaspoon of food-grade magnesium citrate powder dissolved in 8 ounces of warm water taken on an empty stomach can provide relief typically within 30 minutes to 2 hours. Remember the safety considerations. Avoid this remedy if you have kidney disease without first consulting your doctor, and seek immediate medical attention rather than home remedies if you have gone more than 5 to 7 days without a bowel movement, if you have significant pain, vomiting, or blood in your stool. Third, prevent recurrence through consistent hydration of at least 8 cups of fluid daily, a combination of soluble and insoluble fiber totaling 25 to 30 grams daily, increased gradually. Regular physical activity, even in modest amounts, and responding promptly to your body's natural urge signals rather than postponing them. Fourth, if you or someone you love is prescribed opioid pain medication for any reason, proactively discuss a bowel management plan with your doctor at the same time the pain medication is started, not after constipation has already developed. I have spent my entire career in a specialty that most people do not want to discuss at dinner parties, but I can tell you with complete confidence that the seniors who approach this aspect of their health with the same seriousness and the same lack of shame that they bring to monitoring their blood pressure or managing their diabetes are the ones who avoid the kind of emergency that brought Eugene to my hospital bed, that brought countless patients like him into emergency rooms across this country every single day. Your digestive health deserves attention. It deserves conversation. And it deserves the kind of practical, research-backed information that I hope this video has given you today. If this video gave you information that you needed, whether for yourself or for someone you are caring for, I want you to do a few specific things. First, subscribe to this channel, because every week I bring you exactly this kind of honest, practical, research-backed health information that covers the topics other channels are too uncomfortable to discuss in detail. Second, share this video with someone you know who might be struggling with this issue silently, because I promise you, based on 23 years of clinical experience, that more people in your life are dealing with this than you realize, and they are simply too embarrassed to bring it up. You sharing this video might be exactly the permission they need to take it seriously. And third, leave a comment below letting me know if this information was helpful or if you have questions about specific situations you are navigating. I read every single comment, and I bring the most common questions and concerns into the videos I create each week. This is Dr. William, and I want you to remember something simple as you go about your day today. There is no part of your body and no function of your body that is too embarrassing to take seriously. Your health in its entirety deserves your full attention. I will see you in the next video.